Hi, I'm Dr. Verdini. I'm currently a radiation oncology resident at Stanford University in Palo Alto, California. I went to Tufts University for medical school, which is in Boston, and then I went to Emmanuel College for undergrad, which is also in Boston. When I was an undergrad, I was a biology major, and during my time there, I worked at Boston Children's Hospital in a lab, and then I also did research both at the college, and then I also interned at Merck Pharmaceuticals, which was in Boston as well. And then after undergrad, I went on to do research at the NIH for 2 years, and from there, I started medical school at Tufts. While I was at Tufts, I also spent time doing research, but also was on the admissions committee. And as a student member of the admissions committee, I was tasked to review applicants, interview applicants, review their interview score, and then also vote on applicants during the admissions committee voting sessions. So currently I'm a resident and I'm specializing in radiation oncology, which is a specialty specific to treating cancer patients with radiation. And I chose it in particular because I enjoy the longitudinal relationship with patients and how intimate the relationship is with patients and the changes that you can make in their lives. When I was an undergrad, I was awarded the Undergraduate Scholarship Award, which is through the National Institutes of Health. And that scholarship is focused on awarding students who come from low-income backgrounds, who are high-achieving in undergrad, and it provides funding towards their undergraduate degree, and then also with a research experience after undergrad. And so that's where I did the 2 years of research at the NIH. My first year, I focused on CAR T-cell therapy for pediatric malignancies, and then my second year, I was in an immunotherapy bladder cancer group. While I was in medical school, I was awarded the Massachusetts Medical Society Scholarship, as well as the Boston North Cancer Award. One was focused on my desires to become an oncologist and being local to Massachusetts, and the other was focused on my experiences and achievements in medical school. And particularly, I had spent time on the Massachusetts Medical Society committees, one focused on mental health and substance use, which was something that was really important to me. I believe the key to success in medical school is resilience and ability to ask for help. I think resilience is something that most medical school admissions committees look for in students, because regardless of your academic prowess and how you did on tests and how you did in undergrad, medical school is very challenging. And I believe admissions committees look for students who can not only perform well, but also be resilient in the face of many adversities that come along with being a medical student. You're handling a lot of classes, a lot of information, your personal relationships, your hours are a lot, and it can be hard to balance your personal life with what you need to complete while you're in medical school. And so I think the ability to be resilient through these challenges is the key to being successful. And then also with that includes asking for help. I believe sometimes people misinterpret resilience as needing to do everything on your own, but many people who work at medical schools want to uplift and support their students, and so when you need help, it's important to ask for it. So I believe what sets me apart in terms of consulting students for medical school is that I particularly like to focus on what makes that student unique and what drives them to become a doctor. And while that sounds vague, I believe it's the crucial route to the entire application that sometimes is overlooked because students are very focused on their grades and their research and their volunteering, which is all important, but your individuality can get lost in that. And so I work to help students identify what drives them and what makes them who they are, and making sure that that gets highlighted in the application, because often we're hyper-focused on what exactly is the right formula to get into medical school. I was the same way as a pre-med, what research do I have to do, how many volunteer experiences do I need, who do I need to ask for a letter of recommendation, etc. And while I understand that anxiety, it's often been told by many admissions committees that there is no such thing as one right applicant. And when you approach that application that way, it often results in what looks like a templated application, and it's hard to distinguish you from other applicants. And medical schools are reviewing thousands, tens of thousands of applicants, and it can be very challenging for them to pick out, a unique individual. And so I like to focus on what makes you a person, what makes you a strong future doctor, what drives you. I believe my greatest strengths as a coach is that I'm very approachable and I only want to uplift you and help you. And I think that the application process to medical school is anxiety-provoking enough that the person who's advising you should make you feel comfortable. You shouldn't feel nervous. And I believe my strength is helping people feel that, and also helping you identify the parts of you that are unique and will make you a strong physician that you can highlight in your application, since that is what's the most important. I'm passionate about helping students apply to medical school because I was the first in my family to go to college as well as to become a doctor, and navigating that process without family or friends who've done it was incredibly overwhelming, and I had so many questions to ask and I wasn't sure who to ask, and I want to help students have more clarity in the process and support them through such a challenging but eventually rewarding process, and I hope to make information more accessible to students as they apply.